Goni skill, forearm pronation. Position the patient in sitting with the shoulders 0 degrees of flexion, extension, abduction, adduction, and rotation so that the arm is in close to the body. Flex the elbow to 90 degrees and support the forearm. Position the forearm midway between supination and pronation so that the thumb points toward the ceiling. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to pronate the forearm. Assess the distal end of the humerus for internal rotation and abduction of the shoulder. Pronate the forearm by moving the distal radius so that the palm of the hand faces the floor. Make sure your force is applied proximal to the wrist so the wrist is not included in the motion of pronation. As you stabilize the distal end of the humerus to prevent internal rotation and abduction of the shoulder, the end of pronation range of motion occurs when resistance is felt and additional motion causes internal rotation and abduction of the shoulder. Assess the infill of the joint. This is hard because of contact between the ulna and the radius. The infill may also be firm because of tension in the dorsal radioulnar ligament, the interosseous membrane, and the supinator muscle. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. The size and shape of a smaller plastic goniometer will make this measurement easier. Align the axis of the goniometer laterally and proximally to the ulnar styloid process. Align the stationary arm parallel to the anterior midline of the humerus. Place the movable arm across the dorsal aspect of the forearm just proximal to the styloid processes of the radius and ulna, where the forearm is most level and free of muscle bulk. The distal arm should be parallel to the styloid processes of the radius and ulna. Ask the patient to perform pronation of the forearm as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the shoulder. Read the degrees of motion on the goniometer and then ask the patient to return the arm to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion, according to the American Association of Orthopedic Surgeons, is 80 degrees.